Hello, my name is Angel Washington, and I am a medical speech-language pathologist. I help individuals improve their communication, language, and swallowing skills. Today, I want to speak to you about aspiration, or when anything other than air goes into the lungs. Aspiration can occur with food, liquid, saliva, tube feeding, or your stomach contents. Aspiration can occur with a meal, or it can occur after a meal. Now, I know many of you already know those common signs of aspiration, such as coughing, gagging, or choking. But did you know that there were silent indicators of aspiration? You may not have, and that's what I want to speak to you briefly about today. I've identified at least 10 of these silent killers that you need to be aware of when you're working with individuals during their mealtime to help keep them safe. Let's review. Number 1, continuous eye watering or nose running with eating and drinking can be an indication of silent aspiration. Number 2, increased work of breathing or effort to breathe can indicate respiratory distress and possibly silent aspiration. If you notice that the individual is working hard to breathe and their chest or abdomen is rising and falling quickly, that could be an indication of silent aspiration. Number 3, you want to monitor your individual for a low-grade or persistent fever that can oftentimes indicate pneumonia, and pneumonia is sometimes an indicator of aspiration. Number 4, wet-sounding breathing or gurgling, like someone's underwater. That can indicate that the airway is not clear or something is hanging over the airway and increases the risk of aspiration. Number 5, congestion with eating and drinking or after a meal could be a sign of aspiration or silent aspiration. Number 6, noisy breathing or wheezing, like something is blocking the airflow, could be a sign of silent aspiration. 7, refusing to eat and drink. You may not know this, but aspiration is oftentimes painful. If you're an individual that has difficulty communicating, you may not be able to tell someone that every time I eat, it hurts because I'm aspirating. So a lot of times individuals will refuse to eat and drink, and that could be an indication of silent aspiration. Number 8, frequent infections or pneumonia, in particular, right lower lobe pneumonia. Right lower lobe pneumonia is highly correlated with aspiration, and oftentimes it's silent. Number 9, complaints of stasis, or this is when you have a feeling that food or liquid is stuck in one part or somewhere in the throat. That can oftentimes mean that food and liquid is not moving well, or it could possibly be coming back up into the esophagus, and that could increase the risk of aspiration. And last but not least, fatigue. Well, how does fatigue factor into this, you may say? Fatigue with eating can increase weakness, and weakness can increase risk of aspiration. So if you continue to feed someone when they're too tired or not strong enough to eat and drink, you could be actually forcing them to aspirate, and they may not cough or indicate that to you. I've taken the time to identify 10 of these silent killers. I really hope you find this information helpful and that you're able to apply it during your safe mealtime practices in your individual locations. I hope you have learned something today, and I hope you have a great day. Thank you for your time and attention. Take care.